Welcome to day one of our core back protocol about my back masterclass. Hi, my name is Annie. Welcome back to my channel. Annie Pilates physical therapist. I have extensive experience helping individuals with various conditions like back pain, poor posture, and weak core muscles. So if you're new to my channel and you haven't seen a lot of my videos, you can check out in my playlist. And there's so much videos you're gonna learn from me, from weak core, poor posture, scoliosis, back pain, one-side weakness. So that's why in this video, by focusing on full muscle treatment, I've improved mobility, stability, and strength for many of my followers and my patients in the clinic. Core isn't just about the abs. I've talked about it a lot in my videos, and it includes muscles along the sides, the back, the diaphragm, the pelvic floor, and the hips, the lumbopelvic hip complex. So that's why in this video, I'll demonstrate where is the root of the problem. How can we fix the area that needs to be addressed so that you know how to proceed further as we are going to incorporate a lot of... If you missed out my invitation about my reopening of my back masterclass, please don't miss out on the previous video where I demonstrated proper breath work, because that's so crucial before proceeding to this one, because today we're going to find what side is your weaker side, the lower side of your pelvis, your spine if you're in a neutral position, and other factors that will help solve the pain for good. So the weak core muscles can lead to back pain as the body relies on passive structures for stability. So if you've been sitting a lot, standing, walking, and you don't have the stability, a simple task from washing your dishes, gardening, or other factors that you just have to sit, even just driving, could cause pain. And some studies suggest that specific core exercise may not be superior to general exercise for back pain. That's why it's important to know the root of the problem. However, exercise in general can already help. But do you know how to target and fix the root of the problem as fast as we can, safely and effectively, without wasting time? That's why in this video, I'll demonstrate how to identify the weak areas in your hips and address pelvic alignment issues using muscle energy techniques. And this is one of my crucial steps. First step before I proceed to any exercise program. So strengthening your core can improve your posture, but if you're strengthening the area that you don't need to strengthen, then it causes more muscle imbalance. That's why in this video, you will find out which side of your hip is your weaker side, and that's usually the painful side, or that area could be so painful because your compensation leaning on that side. So you have to know by the pelvic alignment. Strengthening your core can improve your posture and alleviate back pain, but you want to make sure you're doing the right and low impact exercises like Pilates, yoga, and this physical therapeutic exercise is one of the cool techniques that you can start right now. And this is video one. There's so much more in store as we have 5 more videos to address your back pain, your weak core, and poor posture for good. That's why consistency and practice can make a significant difference. So find the program you enjoy. And that's why I love Pilates yoga. It's one of the best tools for me, as I experienced a lot of neck back pain from my car accident 6 years ago. And that's why it birthed to my YouTube channel. It's my way of healing myself, and looking at my movement patterns through video while editing makes me see myself. Of course, I believe in physical therapy, but when I'm in pain, I'd rather heal myself. It took me a while, and I found the formula. And this is the formula. I could read thousands of books in college, apply it different theories, but when you experience pain, that's the best wisdom book that you can have to teach and to help as much people. With over 20 years experience providing lasting relief to all of my patients, once you experience pain that's so excruciating, from a fractured sternum and chest to the point of bad posture, to slowly heal myself. So this method can help you achieve a pain-free life with a strong core and improve overall posture. That's why I still have my YouTube channel. Once you have an injury, you want to have to be consistent and continually practice so you don't lose that connection, your mind-body connection to your body. So if you struggle with back pain, weak core, poor posture, this is for you. My core back protocol is a perfect tool to start right now to regain life without back pain, to have a stronger core and improve posture. So in this video, we're gonna need a ball. If you don't have a ball, you can use a chair, because the ball will help stabilize your back. If you're in a lot of pain, this will give you that gentle positioning to keep your hips and knees level to 90 degrees. And then, but before we start realigning your pelvis, you have to find out which one is your weaker side. And I could do some techniques and find out which you can really feel it when you're doing some isometric exercises together with our proper breath work that we already did on my previous video. You can check out over here in the info card, or you can watch it at the end of the video, at the end of my video, and also in my description down below. So stay tuned for my video. Next video, I'll be demonstrating one of my best kept secrets together with a ball, elastic band, to really strengthen your core, your lumbopelvic hip complex. So don't miss out. If you want to be part of this and you haven't signed up on the early bird waitlist for first come first serve basis, write your name and email address down below and start the program. You can access all of these videos for free, so you can be part of the early bird waitlist as I reopen my back masterclass on September 1st. Today is August 20. There's new videos every 2 days, free videos to start to regain your life, jumpstart your core already. It's not too late if you have chronic back pain for many years, if you have scoliosis, this is for you. Okay, let's begin the program. You're gonna lie on your back, slow and steady. Place your legs up on the ball for support, as I said. First, feel that bony prominence on the front of your pelvis, and you're gonna feel one side might be a little bit higher than lower. My left side is my weaker side where I got injured, and my right side is higher. So my left side is usually lower where I have the pain, my SI joint dysfunction. SI joint dysfunction is where there's a bony area here where the sacrum and the iliac meet, and that's where it's always misaligned because of muscle imbalance. And then it creates this quadratus lumborum pain where your quadratus helps protect your spine from overextending, flexing, side flexion to prevent spinal cord injury. And that's why they get really spasmodic and angry when you just massage the area. No matter how much you massage the area, if you don't target the weak glutes or weak core, then it will keep repeating the process. So now I'm gonna place my hand on my pelvis. So just to demonstrate, my left is lower, my right is higher. So if I place my thumbs together in the middle, I could really see the difference. So this is how you can check your pelvic tilt. So use your thumb on top of your pelvic bones. Here is the iliac on top, and then this is her right and this is her left. And then once you connect your thumbs together to the midline towards your abdomen, so making sure you go straight and don't move, keep it going straight. Now that's how you see her area. As you can see closer, again, let's try it again. Her iliac crest alignment from her right and left, and connect. And that's how much is her connect. So her right side is lower than her left. And then if you look at her legs, her feet, it looks like she has a functional leg length discrepancy. It looks like her right foot is longer than her left. And earlier, her left is higher and then her right. And then if you can check it at home, bend your knees, Gabby. You can start bridging first, bridge up, lift your hips up and then down. And you can check again with that glutes activation. Sometimes it realigns, but for her, it's still the same. Her left side iliac crest is higher than the right. So at home, as I said, check it, your alignment on your pelvis. And the leg length, it doesn't mean your bone is longer on one side. It's just the pelvic tilt is lower on your right, so it looks like it's longer. So now, my left is lower, my right is higher. So if you find your left is lower, which is common on the non-dominant side, you're gonna place your hand on top of your left anterior thigh on the top part. Lift your foot up to test the water if this is really your weaker side. You're gonna press against it as hard as you can with your breath work. Take a deep breath. Expand your belly, expand your ribcage laterally as I explained before, and press as hard as you can and breathe out through your mouth as you gently squeeze your core in from your lower abs to your navel, and press as hard as you can without moving your hips. This is called isometric. And you might find it a little bit more challenging, and you might feel a deep ache on your back and your hips, and that's normal, so which means it's weak. And you can do up to 10 repetitions with one deep breath Usually you can start 2 to 3 seconds hold until you can hold it for 10 seconds. So try 10 seconds. 5, 4, 3, 2, 1. And that's when you're gonna feel fatigued and tired. I have big patients, football players with back pain. They sweat just doing this. If you can see the instability and shakiness of their spine and pelvis, and they can't believe this looks so simple, but it's actually very challenging. That's why the ball helps to support. So I'm gently pressing against it. Now let's test the water. So I know this is my weaker side. Test the right side. If this is your higher iliac crest, if you press and you might feel, hey, this is so much easier. I don't feel any fatigue on my hips, then that's a true test. That really shows that your left side is your weaker side. That's where you need to lift and strengthen by doing more isometric on your left. And this one, you don't have to. You don't want to increase that elevation of your iliac crest. So on the opposite side, for me, my right side is my stronger side. You'll be surprised, it's a crisscross pattern. My glutes on my right will be weaker than my left. And it happens a lot on all of my patients with back pain. So I'm gonna interlock my fingers on my right this time. As I said, you don't wanna lift the right side. It's already elevated. I need to lower it down. So with my interlocked fingers, behind my thighs, I'm gently pulling away this time, pulling away, keeping the knee bent without moving, resisting against my hand as I breathe in and breathe out and hold it for 10 seconds. Hold and do this 10 repetitions as well. And as I said, if you don't have a ball, you can use a chair. And if you can't interlock your fingers and you can't reach it, you can use a towel and place it and wrap it around behind your thigh and then pull it away again. Let's do a few more repetitions. Take a deep breath. Almost 2 deep breaths to get the 10-second hold. And after doing 10 repetitions on both sides, one towards you to lift, and you're gonna feel a lift on your pelvis, and then one on the other side away. So that's my assessment. Find out what's yours. And that's why you're here. Leave a comment down below. Let me know how you feel. Now, we need to glue them together. Make a fist, both hands, place it between your knees and squeeze gently. We're activating your hip adductors, and that's why it's so important to glue them in. You're gonna feel some shakiness inside. The pelvic floor muscles are engaging. Take a deep breath. Breathe out and relax. And do that 10 repetitions as well. Take a deep breath and then squeeze your fisted hands between your knees as much as you can. Squeezing your core in and breathe out. And 10 times. After you do that 10 times, open your fisted hands. Place the palm of your hands outside of your knees and gently resist against it. So you're gonna slowly, gently open your knees out, but without moving it, just resisting your hands as much as you can. Take a deep breath, but keeping your back in neutral position. I don't want you to press your back like this. Just gentle, core engaged while maintaining that neutral spine is so important. You don't want any tilting. You want that small space. Keep checking it. Gliding your hand at the small of your back and hold it for 10 seconds. Hold. See, there's still a gentle space here. With your breath work, take a deep breath. Breathe out. And do that 10 times. After gluing them together, now you can progress with a gentle bridge. And this is a gentle progression. The ball will add a different stability and challenge. If you find the ball too challenging, you can remove the ball and just do a gentle bridge as you breathe out. And then once you reach that bridge, take a deep breath again. And then squeeze the core in from your lower abs to your navel and then roll down bone to the mat and breathe out. If you're having pain when you bridge, you're not ready yet. You might be compressing your lumbar spine And that's why each one is different. There's always tomorrow. Put heat on your back first before you proceed. And now with the ball, you're going to feel a little bit more challenging. Inhale, exhale, glue them together. Your hamstrings are working harder. Then roll down, bone to the mat with your knees bent. If that's still too challenging, you can also modify with your knees straight and then find it so much easier with your knees straight. As you breathe in and breathe out. And that's it. I'm hoping you learn about how to find the root of the problem once you find out which one is your weaker side and which one is your stronger side. And that's why I am here to guide you to find a good approach without second guessing what's going on with your body, the muscle imbalances. And this is not just taking medication. Surgery is not always the option. And there's so much more techniques because I believe our body has a way of healing. And I've seen a lot of my patients prevented surgery. And it's a game changer because surgery is usually will have a lot of complications. I believe in surgery if you're already bedridden and you can't walk anymore and you're in a wheelchair and you're compressing your spinal cord. If you have trauma. But if you're just having chronic back pain, you're still moving, some numbness, tingles, sciatica, it's fixable with physical therapy, Pilates, yoga, core back protocol. So whenever you're ready, click the link on the description below, write your name and email address, be part of the early bird waitlist so you don't miss out on my second video. In the next 2 days, I'll be demonstrating one of my secret recipe that I've been using to a lot of my patients using my elastic band on how to engage your dead butt syndrome. That's been a phenomenon happening since COVID. Patients who have been sitting a lot, working from home, sedentary, and then all of a sudden they started being active without feeling their glutes activating, that causing this a lot of back pain, muscle imbalance, SI joint dysfunction, and sciatica. I'll see you inside my next video training. Always remember, be safe, be well, and healthy you. If you have more time today, watch this video about how to do proper breath work with my invitation in the last few weeks that I just released, and also watch this video about dead butt syndrome. Until next time, see you in my next video training. Bye.